Hello everyone, I'm Tim Justinger, and this is my feasibility of opening an urgent care clinic. Throughout the presentation, I will discuss the feasibility of opening an urgent care clinic 20 miles from the 673rd Medical Group while explaining the basic microeconomic model, public policy, financial projections, economic challenges, and incentives to the new project. So the urgent care will be located 20 miles away from the 673rd Medical Group. The center of Eklutna is exactly 24 miles from it. And strategically placed, the urgent care can assist with outpatient care between Anchorage, Wasilla, and Palmer. The urgent care can assist in preventing overcrowded emergency departments in the area. It will provide care for the frequent cold weather injuries, minor injuries, ailments that are non-inpatient, and pull patients away from the already busy staff of emergency rooms. So the role of public policy is like the laws, regulations. The community will be involved in this. So obviously there needs to be accreditation for the urgent care centers. The main ones that come to mind are the UCA, UCAA, Joint Commission, and there's some other ones too. But one huge issue with having an urgent care and wanting to keep patients within our own health organization is some of the laws, like the Stark Law. So the urgent care cannot refer the patient to our own health organization from the urgent care due to this law. The physician's self-referral law, also known as Stark Law, forbids doctors from referring patients or organizations with which they are a member or the immediate family has a financial relationship in order to receive specified health services covered by Medicare or Medicaid unless an exception applies. So ownership, investment, interest, and rumination arrangements are both examples of these financial ties. Unless it is done randomly by a referral outside of their control, doctors may be employed at the urgent care center won't be allowed to see patients after the appointments. So financial data projection. So obviously labor is expensive. This is a long-term investment. Patients' visits should not exceed the time provided, and there needs to be determination for cost for care, with data analytics playing a key role in designing the average cost for these visits. The treatment and release of patients' visits at urgent care clinics are unscheduled and should last no longer than an hour. Furthermore, patients' demands for better, quicker, more dependable, and simpler access to healthcare place pressure on the clinics. So there must always be a provider in the facility and medical staff to accommodate the provider or providers, depending on how far we're going to expand with this. And maybe it will even be possible to leverage existing staff from the main hospital to accommodate any staffing issues that may arise from the urgent care. So we have economic challenges. That includes, overestimations. You need hospital stakeholder approval to even get this off the ground. You need to finance the urgent care, labor cost. So bad forecasting of finances can be detrimental to the healthcare organization, especially if a lot is invested into it. Negative long-term consequences can also result from overestimating sales. If a hospital's projected census was too high, it can add too many beds. This surplus will reduce earnings for a while because the facility will have to increase staff and equipment to match this inflated prediction, and the cost of doing so will be significantly higher than actual sales profits. Incentives related to the urgent care. So obviously we're going to reduce the patient wait times. It's all outpatient visits. There are really many incentives to doing this, and creating an urgent care center through this. The wait times are cut, so that the patients are on the clock. Patients will be intrigued by these reduced wait times, ability to just come in and get seen, the cost friendliness of the whole thing, and the ability to have the facility within a short driving distance of any one of these three cities, as well as all the hiking locations around the area that they might get small injuries and just want to get seen. So conclusion, throughout this presentation I've discussed the feasibility of opening an urgent care clinic 20 miles from the 673rd Medical Group, explain the basic macroeconomic model, the public policy, financial predictions, economic challenges, and incentives of this new project. I hope you all consider.